We all have our abilities and talents. We have our limitations as well. Let's accentuate the positive, and that's what it's all about with Associates in Pediatric Therapy. With me once again is Renee Sagasser. Renee is the CEO. She's also a speech pathologist as well.
Yep,
Renee,
right.
welcome back to the show.
Thank you for having us back.
All right, we've got a nice-looking crew here, too. We're celebrating Feel Good Friday. We have our patient of the month, Katie. Welcome to the show.
Thank you.
Nice to see you. And Suzanne, her mother, very proud mom.
Yes.
And also Susan Adams, who is also a speech therapist. Welcome, everyone.
Thank you.
All right, before we get started here on Katie's story, and it's a great story, let's talk a little bit about Associates in Pediatric Therapy and exactly what you do.
Yes, so we offer a variety of services, speech therapy, of course, and then occupational therapy and physical therapy. We also have ABA therapy, behavioral therapy, and then we have a learning center. We have offices all around the area, Shelbyville, Louisville, Bullitt County, Oldham County, and New Albany. So we're able to provide services not just in the Louisville area, but the surrounding ones as well. So great team, and excited to be here today to spotlight our patient of the month.
Yep, and our patient of the month is Katie, and she is bright, she is beautiful, Mom is very proud, and rightfully so. Mom Suzanne, if you don't mind, tell me a little bit about Katie's story and how you became introduced to Associates in Pediatric Therapy.
Katie was diagnosed with epilepsy when she was about 4 months old. She began speech therapy when she was 2. She was with First Steps, and when she turned 3, she entered Jefferson County schools. Her dad and I put her in private school when she was in 1st grade. So from grade school, she went to Meredith Dunn and she went to Summit Academy. And she moved over to the Academy for Individual Excellence, and that's where she graduated in 2014. And her dad and I thought that she needed a little bit of help after graduation. The services ended, and we contacted our representative at 7 counties, Adrienne Todd, and she recommended APT for the services. And we've been there since March of last year.
Well, I opened up the show and I was talking about, all of us have our abilities and talents. All right, Katie, so where are your talents? What do you like to do? What do you wish to do?
Well, I like to cook with my cousin Abby. We do a lot of cooking. I like to go shopping anywhere.
Fantastic.
That's awesome.
All right, well, so what's your specialty? What do you like to cook? Name one dish that you really like to cook, Katie.
The pumpkin pancakes.
Ooh, that sounds pretty good.
Oh,
All right, I know where I'm going Sunday.
Yes. Those are good.
That sounds really good. Okay, Mom, tell me about some of the improvements you saw when you went to Associates in Pediatric Therapy, things that you saw in your daughter.
I think the most important thing with having, a young adult like this is not just speech. I think it's more about communication. I think it's more about communicating with other people without me there, without her dad being there, making her needs known or what she needs, just talking on her own. That's the most important thing for us now.
Well, in the short period of time, I've been very charismatic. She engaged with me. Katie, thank you very much.
Yes.
You made me feel special, and that's important. I mean, that is a skill. When you get in the room to make people feel like they're recognized and you want to engage with them, so you're doing very well. Okay, Susan, you're her speech therapist. So tell me a little bit. It goes beyond, as Suzanne said, her mother said, it goes beyond speech. It's a relationship as well, isn't it?
Yes, it is. And Katie and I've only had the joy of working with her for a few months because she got transferred to me, but she's been wonderful to work with. She's working on some functional communication skills, socially pragmatic, how to get along with others, and she gets along with others, I don't mean it like that, how to carry on a conversation, the reciprocity back and forth with other people. We've been working on sequencing skills, activities of daily living like cooking independently for herself and for her family, which I know she has done so at home.
Yes.
So that's kind of exciting.
It is exciting. Suzanne, was there like a breakthrough day, maybe a day when you go, okay, today I really see some improvement, or maybe an event happened and you were really proud of Katie? Can you maybe bring back to your memory and relate that to us?
She's been doing a lot of cooking or snack making at therapy, and when she wanted to make snacks for her brother and for me, I thought that was a big deal.
It is a big deal.
I think it is that she took the initiative to say what would we like, and we had to stand on the other side of the counter while she made our treat. So I thought that was good.
For parents who may be apprehensive, and obviously, everyone, I think, if you're a parent, you're very protective of your daughter or your son, and there may be a little apprehensive and think, should I do this? Should I go to Associates in Pediatric Therapy? What would you recommend?
I don't think it hurts to just have an evaluation. I think that that's important. And I think it's a very kid-friendly place. It is very welcoming to families.
So when does it happen, Katie? We might as well reveal it now. When are you opening up your new restaurant? Is that going to happen? But congratulations to you. I mean, really, I'm glad that everything is going so well for you. She is the patient of the month. And Renee, for those who want more information on Associates in Pediatric Therapy, first of all, I guess we should talk a little bit about other issues, other challenges that you address.
Yeah, we definitely work with anybody with just learning developmental delays or autism, CP, Down syndrome. Those are just a few of the different disabilities we work with. But you know, they can come in anytime for a free screening as well. So we're here to see if they want that at any time. They can come to any of our offices. I think the one in Shelbyville is listed there right now, and the one in Louisville. But they can call us. Go to our website at kidtherapy.org and check out more information. So yeah, we'd love to help them. And just want to say congratulations, because I think this right here is a huge accomplishment on all the goals that you've been working on, and you've just done a great job today too. So we're very proud of you.
You know, we sing the praises of Associates in Pediatric Therapy on this show, and rightfully so. But with that being said, I meet just the neatest, most hands-on, loving parents. And Suzanne, you are definitely that. I can just see it in your eyes. So congratulations on having such a bright and beautiful daughter.
Thank you.
Is that appropriate? I guess it is.
Yes, definitely.
Susan, before I let you go, being a speech therapist at Associates in Pediatric Therapy, it has to be really rewarding when you see improvements made in some of the people that you work with.
Absolutely. That is the biggest thing. I mean, I think as a speech pathologist, it's not that just helping the students, which we want them to, you know, get their goals and be able to communicate, but it's so rewarding when parents say, oh my gosh, for the first time, Katie was able to dress herself because she learned how to, you know, look at an app and be able to figure out what the weather was going to be like, or she's able to, you know, cook a meal for us. I mean, that's so rewarding to hear that she's able to follow through with those skills.
All right. And Renee, you mentioned that you can come on in and get a free evaluation. With that being said, should they check it out on the web? What's the best way of getting a little more information?
They can definitely go to our website, thekidtherapy.org, or just give us a phone call and we'll set something up for them.
All right, there's that website right there on the screen. Again, Associates in Pediatric Therapy. Good to see you again, Renee. Nice to meet you, Katie. Suzanne, congratulations again to you. And Susan, thank you for the work that you do. I really appreciate that.
Absolutely.
All right, coming up, folks, we have a Louisville